Hey, yeah, hey, yeah. Hey, lovelies. How are you? How is God keeping you today? Okay. So, thank you for coming back. Thank you for watching. Thank you for keeping glued here. Okay. If it's your first time, please subscribe to my YouTube channel. And if you're a returning subscriber, thank you for watching. Please recommend this to your friends, to your family, anyone who you know who may need this. Okay. So, without wasting your time, let's go into the we're going to look at sepsis today. Okay, we've heard that sepsis stroke postnatal care. Okay, so we're going to go right into the marking criteria, and then we're going to look at the how to go about the scenario. I think do I have a scenario here? Okay, let's go through the marking criteria. I'll have a simple quiz and yeah. Okay, so number one, accurately calculates the mu score, completes the chart in full, and signs. This is the marking criteria. Looking at the 9 postnatal marking criteria. Okay. Accurately completes the inpatient maternal sepsis screening tool in full. This is the inpatient maternal sepsis tool. Okay. So you should know how to complete this and know how to analyze it. This is it. Then we come down to the recommendations. What happens when you get a yellow or red box? Okay. Then number 4 uses the inpatient maternal sepsis screening tool to make an accurate assessment of the woman's condition. So when you fill in the sepsis tool and the Muse chart, it will help you have the recommendations on what to do when you have an amber box, when you have 2 or more amber boxes and 1 red box, when you have 2 red boxes. Okay, the samples of answers there. I'm sorry about that. Identifies the appropriate escalation informed by both the Muse chart and the inpatient maternal sepsis screening tool. 6 uses SBA tool to outline the appropriate next step for care. 7 identifies appropriate staff or grade to escalate concerns to and indicates diagnosis. 8 verbal communication is clear and appropriate. 9 actually. So in 9 acts professionally throughout the procedure in accordance with the NMC 2018, the Code Professional Standards of Practice and Behavior for Nurses, Midwives, and Nursing Associates. So those are quite a few according to marking criteria, and they're quite precise. Sorry. Very sorry. I don't know why I'm yawning. Sorry about that. So let's go through the sepsis quiz. What you should put in your mind when you get a scenario about sepsis. So name 3 risk factors for sepsis in either antenatal, labor, or postnatal period. Prolonged labor, early rupture of membranes, episiotomy. If you have any other answers, please also comment with other views of yours. Number 2, what samples or specimens need to be taken when dealing with postnatal sepsis? So we have the high vaginal swab, we have the FBC, urea, creatine, clotting time, then the bloods for lactate, and then culture. Okay. Then number 3, what documentation needs to be completed when looking after a woman with sepsis? So we have the sepsis screening tool, which I've shown you, and then we have the Muse chart. Then also this is not but remember to do the 3Ds, that is the debrief, telling the patient what happened and giving a report to my colleagues. Then you have to do the documentation and the ethics. Okay, so what are the 3 ins and outs of sepsis? The ins are the IV fluids, then the IV ABCs, then oxygen. What are the outs? The outs are blood samples, urine samples, and swabs. So what do you take off, what do you give? Okay. What type of antibiotics should be started when you identify a mother who has sepsis? The broad spectrum antibiotics. Okay. So what needs to be considered if observations are becoming extremely deranged, e.g. a mu score which is less than 6? So you have to initiate critical care. Then what is the ideal time that all your sepsis management should take place in 1 hour, which means you should be as fast as possible once you identify it, because it's a life-threatening incident. Okay. 9, you are looking after a woman in labor who has you're looking after a woman in labor who has an epidural. She has now had temperatures above 37.8. You inform the anesthetist and obstetrician, who inform you they are not concerned. That is a side effect of the epidural. What is your response? 1, you escalate. Whom do you escalate to? The senior midwife, and then request for blood and do full head to toe assessment of the woman. Okay. So that's the simple quiz of things you should know, and then we're going to look into the how to Postnatal Sepsis. Remember, we said the things you don't forget is that you have to fill the MUSE chart, sepsis screening tool, and remember to sign, date, and your name. Okay, so when you go to this station, the MUSE chart will be provided and it's already filled, so you just sign, count the reds, count the ambers. Okay, there is no contact with patient, so you will be given a scenario and some history, like which was like maybe the mother delivered 6 days ago or 3 days ago. Okay, so then at the bottom of your MUSE chart, remember to fill in the total number of ambers and the total number of reds, and also monitoring the frequency of the observations at the back of your MUSE chart. Okay, and also escalate care and also refer. Okay, for the inpatient sepsis tool, remember to fill in the date, your name, designation, and signature, patient details, the name, and the date of birth. I've showed you how the inpatient maternal sepsis tool looks like. So this is where you're supposed to fill the patient details and then the staff details. You see, the name, the date, name, designation, and signature. Then this is what you fill for the patient. Then you go on to this. Okay, so we shall go on to what. So let me go through in the inpatient sepsis tool. Then they ask you, has the MUSE triggered? Yes. Could this be an infection? Please tick 1. Is the maternal red flag present? Tick yes or no. Is the maternal amber present? Criteria present? Tick. Red flag sepsis the last row, please follow the sepsis pathway within the first hour. So, and also ensure the clinician attends to the patient as soon as possible. Plan emergency buzzer or refer to the obstetrician. Sorry, I didn't say we know. In the how to, we are going to start as ensure. Remember, it's an emergency. Also ensure the clinician attends to the patient as soon as possible. Plan emergency buzzer, refer to obstetrician review. If you're in the community, you need to call the paramedics, and also bear in mind, if the patient has a child care, you have to contact the child care, or if they have pets, you have to look out for the people concerned with pets, and the social care personnel should be informed. So you're going to start oxygen if the saturation less than 92. Then insert the IV cannulas, send blood for lactate, FBC, UNEs, CRP, LFTs, clotting factors, and then you're also going to confirm with your assessor if the bloods have been sent already. You have to just mention them. Then you go on to give the antibiotics that have been prescribed by the doctor. Then you're going to commence hydration. I mentioned the hydration fluids that you can give. Then you also continue to monitor the mother until she gets better. Then after you finish everything, you're going to hand over to the assessor in SBA. I hope we all remember the SBA, the situation, background. Do you remember all that? Situation, background, assessment, and then your recommendation. Okay, in that form is how you give the feedback to the examiner. If you have watched the previous videos, we know that we know how to give the feedback. Let me see. So also now about this. Remember, this session also spends it takes 15 minutes. So should we go through the amber boxes? Yes or no? Through the Muse chart. Anyway, you get it when it's completed, so it has most things done. So if you get one amber box, you repeat observations, increase frequency of observations to 30 minutes, seek advice from the senior midwife, or consider an obstetric review within 30 minutes. If you get two amber boxes, one red, you inform the midwife in charge, immediate referral of obstetric register, increase frequency of obs to 15 minutes, woman should be reviewed within 30 minutes, consider review of the obstetrician, anesthetist, and consider review by the obstetric consultant. Then if there are two red boxes, if there are two boxes from the Muse chart, inform the midwife in charge, immediate referral to obstetric register or anesthetist, and transfer to a high position of care, and then consider transfer to high dependency and consider review by the consultant. So what you're feeling on the Muse chart is your initials, escalation of care, yes or no. Then you go to the monitoring frequency, total number of red boxes, total number of amber boxes. Then in the maternal sepsis tool, what you're feeling, you should fill in where you are. Are you in the community or are you in the hospital? Note how to refer and how to hand over. Then follow the sepsis 6 pathway. I hope we know the sepsis 6 pathway. Okay, so if you're in the community, you're going to call the paramedics immediately. If they have children or pets, call social services, insert IV cannula, take blood for CRP, lactate, and clotting, commence IV antibiotics, commence IV fluids, and monitor continuously. If you're in hospital, ensure that clinician attends as possible. Put oxygen if less than 92. We've gone through that. So in the hospital, you don't do anything without informing the clinician or the obstetrician who is available for that, who is responsible to undertake patients under sepsis emergencies. Okay. In the community, we've seen what to do, and in the hospital. So what else? You hand over according to SBA. We finished that. Anything else to note? Oh, also another thing to note, when you're calling in the community, it's 99. If you've not watched my previous videos, it is 99. In the hospital, it's still 2222, 4 times. That's the number to call for the other team. Okay, so you discard your PPE and document. How quick is that? That is so quick. So another thing, yeah, I think we've gone through the immediate things you need to do. The sepsis 6 pathway, yeah. Yeah, that's what I've mentioned in the sepsis 6 pathway. Ensuring there's a senior clinician, commence oxygen, bloods for FBC, UNDS, CRP, LFT, blood cultures. Yeah, we've gone through that. Administer IVs, administer IV antibiotics, administer IV fluids. The IV fluids, it is Hartmann's solution, the Ringer's lactate. Okay, and you should also. So I want to show a close-up of this, the inpatient sepsis tool, to see if some of you can be able to read this. We finished with the patient. Then number 1 has the muse triggered. So you tick yes or no. Then you go on, could this be an infection? Then you go on, is one maternal red flag present? Okay, the red or the amber boxes we were talking about. Okay, I don't know how you can see this. So from there, I think I will need to do something clearer. So these are the path. It should be this: administer oxygen, the pathways. Administer oxygen, take blood. Okay, for cultures, give IV antibiotics, give IV fluids, check for serial lactates. Check for serial lactates, measure the urine output. However, all this is according to your trust protocols. So where it depends on where you're working, follow that, because each trust, they have their protocols on how to handle things. Okay, so then this is the early warning news chart. So you fill in your observations accordingly. My god, the letters are too small. I need to, my next lesson is going to be how to enlarge these pictures, because I can't handle. Okay, so yeah, I think you can see this is the amber and then the red. What to do at 1 amber box, what to do at 2 and 1 red, and what to do at 2 red boxes. I need to do something clear. I feel like this, people cannot be able to see this on the screen. However, I think let me end this video here. Thank you so much, guys, for watching. That was it about postnatal care sepsis. That's what you need to do. So I send you bye-bye from my baby here. We love you, and thanks for watching. Come back again. Please recommend, please subscribe, and ask us questions you need to know. So we are free to share. Let this be like a discussion. We're all learning from each other. Thank you so much.